This video focuses on nursing protocols. What is meant by nursing protocol? Nursing protocol means a written document mutually agreed upon and signed by a nurse and a licensed physician, by which the physician delegates to the nurse that the authority to perform certain medical act. Nursing protocol is nothing but a written document. There is a mutual agreement between a nurse and a licensed physician. By this agreement, the physician delegates to the nurse that the authority to perform certain medical acts. It can also mean a specific written document that prescribes nursing action in a given situation. It is a written document that specifies the nursing action that can be taken in a given particular situation. Coming to the importance of nursing protocols, in high acuity and critical care settings, nursing protocols help prevent complication, promote faster recovery among patients, enhances safety of the patient, increases nursing autonomy, and it reduces the cost of healthcare. About the requirements of making nursing protocol. The registered professional nurse who uses a nurse protocol must have a valid current RN license or registered nurse license, and she should have undergone training or orientation related to each medical act authorized by the specific nursing protocol, and she should adhere to the written nurse protocol completely. So she should have a valid current RN license, should have undergone appropriate training, authorized to practice the protocol, and she should adhere completely to the written protocol. Requirements continues. It must be reviewed, revised, and updated periodically. This protocol must be reviewed by the delegating physician at least quarterly, and these are available and accessible in each of the setting where it is applied. Also, the protocol should include specific terms or conditions under which delegated medical acts can be performed. It should specify the terms and conditions where or when the medical acts can be performed. It should include conditions for immediate consultation with the delegating physician in his or her absence. It should mention when the nurse has to contact the physician who has delegated the activities. Then include a statement that the RN has read and understand all statutes, rules, regulation pertaining to nursing practice under the nurse protocol. These are the requirements of nursing protocol. Then, who developed nursing protocol? Nursing protocols are developed by experts. They craft a concise set of recommendations in their area of expertise. These recommendations, which are drafted by experts, are based on current comprehensive evidence. Then, these experts have to continuously monitor and weigh new evidence to see whether existing protocol need to be updated. That is what in the requirement we have told. Each protocol has to be revised and reviewed at least annually. Now we will see some of the barriers to implementation of nursing protocol in this setting. First one, resistance by the staff to the development and implementation of protocol. Second, there is something called change fatigue among the staff because today's staff or clinician is often overloaded with continuous changes in every aspect of clinical practice. Day by day, technological world or technology is advancing, including in the healthcare sector. So one practice may not be there tomorrow, or a practice in this week may be changed by next week. So today's healthcare professionals are fed up with the frequent changes. So they may have change fatigue. Because of this change fatigue, there may be barrier to implementation of protocol. Next, poor communication and education about protocol by the developers to the users. Then there is lack of involvement of nursing staff. If nursing staff are better involved in developing a protocol related to their area of care, there will be better cooperation. Here we will see some of the differences between two commonly used term or interchangeably used term. One is protocol and the other is standing order. They are not the same in real sense. As we have seen already, protocol means a series of action which may include a number of medication. Protocol mention a series of action. It may be a number of medication, not just one medication, that may be implemented to manage a patient's clinical situation. So it includes a series of action implemented to manage a serious clinical situation. Standing order means it is a medical treatment order generated by an authorized prescriber who identifies an action or medication that must be implemented or administered. So it is a single medication treatment order, whereas protocol is a series of action. Both are used to manage patient's clinical condition. Another difference, a protocol includes alternative action. Already we have seen it is a series of action. So it includes alternative action. So these alternative action or exceptions are addressed by the application of an algorithm. In the protocol, we can see an algorithm. If yes, this has to be done. If no, this has to be done. Likewise. Whereas in the standing order, there is no algorithm or there is no alternative option. It is an order conditioned upon occurrence of certain clinical event. If there is a clinical event, especially in a patient, an order has to be carried out. There is no alternative or there is no exception. The important characteristics of a standing order is that all patients who meet the criteria for the order receive the same treatment. That is not the case in protocol, since there are exceptions of treatment. This is the end of this video. Thanks for listening.